The public health sector facing a critical situation in the management of COVID-19 cases as infections and deaths climb in the face of no available bed space at the Princess Margaret Hospital. The severity of it all, one of dire concern for senior health officials.
So we are at breaking point. It really doesn't get any clearer than that. PMH's Chief of Staff and Emergency Physician Dr. Carolyn Burnett-Garraway there, painting a dismal picture of the current state of the public health sector as the country continues to wrestle the ravishing impact of the COVID-19 pandemic. And Garraway is by no means alone with her sentiments. Equally blunt on the issue, Hospital Administrator Mary Walker says PMH is in emergency mode, inundated with persons presenting themselves with the virus. The difference this time around is that they appear sicker.
And we are up to a capacity today of 30 plus persons in the hospital, 30 admitted. 2 of those persons are on ventilators. And we also have what you call persons under investigation who are being assessed for COVID. And right now there are currently approximately 8 of those persons in our emergency room right now. We are also challenged with regular admission beds, and at this point in time this morning we started off the morning with about 14 persons in the emergency room also waiting for an admission bed.
Local infectious diseases specialist Dr. Nakia Forbes says there are many things that are contributing to the global surge in COVID cases, one of them emerging variant strains.
The Delta strain, which is projected to be the most predominant circulating strain right now in North America and many other locations, is very infectious. It's about 60% more infectious than another strain, the Alpha strain, that was deemed to be more infectious than the original COVID strain. Additionally, we have people getting tired of following those public health precautions and under vaccination and reopening of countries and business as usual. And all of this is causing concern, and it's alarming because I was just reading this morning in Infectious Disease Society of America news that globally and here at home, we have to be concerned that there's going to be a resurgence of COVID-19, despite the advancements we've made with the vaccine over the last year. But we have learned some things, and we know that COVID is not going away.
In the face of it, some may argue that perhaps the Bahamas needs tighter restrictions. Walker says on their end, clinical advice and recommendations are made, but it's up to the cabinet to make a determination.
Yes, we will always fall back on our public health measures of how to sanitize, to social distance and where you're covering. Persons also trying to balance that with the economy. But if you start seeing a demographic where the younger persons now are getting more severely ill, this is your workforce. This is your workforce of today and for tomorrow. And if they're now starting to die out, there's an issue.
If you missed anything, we've got you covered. Subscribe to our ZNS Network YouTube channel and follow us on our social media platforms, Facebook, Instagram, and Twitter for breaking news, live event coverage, web exclusives, and much more.